And, and then just as a reminder, if you can please mute yourself and turn your camera off just during the presentation. Afterwards, there's going to be plenty of time to ask questions. And so I will go ahead and turn it over to Erica. Erica, thank you so much for joining us. We're really excited to hear your presentation. And like I said, everyone will get to questions afterwards. So I will go ahead and pass it on to you, Erica.
Thank you, Holly. I'm going to keep this really casual this evening. We'll do a quick presentation. I'm primarily focusing on constipation tonight because I think that's one of the biggest concerns related to chromosome 18 conditions. But feel free to ask any questions at the end. And if I don't know the answer, I will find out for you and get back to you. So let me get this going. So again, I'm Erica Annotti. I'm a nurse practitioner at the PDGI clinic at University of Texas in San Antonio. I've been there for a little over 3 years now, but I've been working in pediatrics since 2012. So about 10 years of experience with kids. I'm going to focus on kind of what we're looking at with constipation, what you can do at home, what's normal, what's not normal, and kind of what to expect when you have to go see a gastroenterologist or a nurse practitioner, and things that we might do or recommend for your kiddo. So I'm going to move, let's see, there we go. So what's normal and what isn't? I think the most important thing to take from this slide is that every child has their own normal. As you can see from this table, babies tend to stool very frequently, and then as you get older, that number goes down. But on average, I would expect most kiddos to have a soft, mushy bowel movement. Think like almost applesauce. Other day. There should be no pain when they have a bowel movement, no straining, no blood on or around the stool, no smears in their underwear, no accidents. Those symptoms can all go along with chronic constipation. And so if you're not seeing those, that's excellent. If you are seeing some of those symptoms, that could be an indication that something's going on. This is a stool chart that we use every single day in clinic. It just kind of helps us identify where we're at. And so I'll often pull this up on my computer and ask patients or parents to just point to what they're seeing. Type 1 is hard little balls, little pellets. Type 7 is like watery diarrhea. And then you have kind of the in-between of all of those. And I would say the goal is to get close to this type 4. So long, smooth, mushy, no pain. Like I said earlier, that's kind of where we're aiming to get to. The most common type of constipation in pediatrics is by far what we call functional or benign constipation, meaning it's not due to any underlying disease process. This is especially common in the young child, young school age kid. There's a lot of behavioral issues. Sometimes the loud noises of a toilet can cause them to become scared. They don't want to sit on the toilet. It hurts. Sometimes parents can be really pushy with their toilet training and they're not ready. So instead the child just starts to hold it in, and that can make constipation worse. Sometimes kiddos don't want to use a toilet outside of the home. If there's been any major changes to their routine, let's say you've moved houses or if they've just started preschool, all of those things can contribute to dysfunctional constipation and make it a little bit worse. And then another thing is diet. Kids, especially those young ones, are very, very picky. They like to eat a lot of the white kind of bland foods, which are excellent for causing constipation. They don't typically drink enough water. Dairy is really, really common at this age. So they want to drink a lot of milk. They want their macaroni and cheese. They want their yogurt and ice cream. And all of those things make constipation worse. So it's almost like this perfect storm of things at this age that makes constipation such a problem. There's a lot of other conditions that can also cause constipation, and these are some of the things that really we start to work through and rule out once you make it to the GI clinic. But some of the more common conditions are celiac disease, cystic fibrosis, Hirschsprung's, any muscle or nerve dysfunction in the GI tract, spinal cord issues, anatomic malformations, thyroid diseases, electrolyte imbalances, and then there's a whole slew of medications that can also cause constipation. Bringing this back to chromosome 18 abnormalities in constipation, I would say probably the most common issue is hypotonia. This is really common in kiddos that have these abnormalities. And if you think about it, if you have, let's say your legs have poor tone and your legs are a muscle, your GI tract is a muscle. And so it just makes sense that if you have poor tone or low tone in your legs or your arms, you're probably going to have that in your GI tract as well. And so that's going to result in your muscles not functioning and contracting as well or as efficiently as we would want. And that can cause constipation. Decreased mobility can also slow down digestion and worsen constipation. Poor feeding or oral motor problems can lead to nutritional deficiencies, low fluid intake, and that can contribute to constipation. And then also just developmental delays can impact a child's ability to, one, potty train successfully, achieve full control over their bowels, or even just verbalize what they need or don't need. And those different delays can lead to them withholding the stool, like we talked about earlier, and worsening the constipation. So starting at the very beginning, what can you do as a parent to help your child? So some of the easiest things, make sure your child is getting plenty of water and fluids. Really reduce, or honestly, if you can eliminate dairy completely, that can really have a positive impact. Offer a well-balanced, healthy diet as much as you can. There's this rule of 3 for fiber intake, excuse me. So basically, the rule is your age plus 5, I'm sorry, rule of 5, not rule of 3. So for example, if a 3-year-old needs to get extra fiber, we would recommend the 3 plus 5 gives you about 8 grams a day. Now in clinical practice, I don't typically tell parents, okay, you need 8 grams a day, you need 9 grams a day, whatever the case may be. I really just try to push a well-rounded diet as much as you can. And then sometimes we'll add in like benefiber or something like that if we need an extra push with fiber, but more so just really focusing on a well-balanced diet and water are kind of the big things. Another tip is to offer plenty of the pea fruits. So fruits that start with the letter P, pears, prunes, peaches, plums, pineapples. Those are all excellent for constipation. Berries, any kind of berries are really great. You can do juice. You just want to make sure it's no more than about 4 ounces a day because of the sugar content. Coconut water, coconut milk, coconut oil if you're cooking with that, and flax and chia seeds are also excellent for constipation. So making smoothies or things like that with these food products can be really beneficial. Reduce or eliminate constipating foods, like we talked about earlier, those bananas, applesauce, breads, fast food, all of those are super popular, especially with our younger kiddos, but they're very constipating. So if we can eliminate that as much as possible, that can also help. Another thing that I recommend is having a really strict toileting schedule. So pick 2 or 3 times throughout the day that you can sit your child on the toilet, ideally about 20 minutes after they eat, and just have them sit there for 5 to 10 minutes and encourage them to try to have a bowel movement. If they can't, that's completely fine. Just keep it really positive. But the goal is over time, the body is going to learn to start having a bowel movement at those times, ideally at least 1, if not twice. But it does take some time to get to that point. I'm sorry, my throat is really dry tonight. The allergies in South Texas are terrible. Okay, so along those same lines, you also want to make sure your child is positioned appropriately when trying to have a bowel movement. So propping their feet up on a step stool or using a squatty potty can really help. Again, the positive reinforcement that we talked about, no punishment, don't worry about it if they have an accident, just really continue to encourage them. Sometimes sticker charts or whatever it is that your child loves to see, either their success being tracked or something that they enjoy. Maybe they get a small toy at the end of the week if they have 5 bowel movements in the toilet. Whatever it is that you can do to offer that positive reinforcement can be really helpful. And then most importantly is do not try to force toilet training if your child's constipated. Really get that constipation under control first and then try again. Okay, so when should you seek help? I'm a firm believer you should seek out help anytime you're concerned. But so sorry. If these typical management strategies that we're talking about aren't working, I would definitely reach out for help. If your child is in pain or acts scared to have a bowel movement, if they're having frequent accidents, or if they're having alternating hard stools and diarrhea, that can be a sign of chronic constipation. Anytime there's blood in the stool, chronic abdominal pain or nausea or vomiting that's associated with the constipation, poor growth, poor weight gain, decreased appetite, or frequent urination or bedwetting can all be associated with worsening constipation. So first, I recommend talking to your pediatrician. They'll often review kind of those things that we already talked about, and then possibly start them on some kind of stool softener like Miralax or lactulose. If you're not seeing any improvement, or you think your child might require some more aggressive management, then I would go ahead and ask for a referral to the GI clinic. So once you get to our clinic, what's going to happen? First, we're going to take a really detailed history of your child's medical history and bowel movement habits starting from birth. Depending on what we find out in that history, we might order some blood work, an abdominal x-ray, or other tests to see what might be causing the constipation. Almost always, we're going to recommend doing a home bowel clean out to essentially restart your child's bowels, because if there's the constipation, the hard stool have gotten really backed up into the intestine, we need to flush all of that out to give the intestines time to shrink back and function like they're supposed to, because they've gotten really stretched out to accommodate that hard stool that's in there. And then sometimes we do have to admit kiddos to the hospital to do the clean out if they can't do it at home. Some of the other more aggressive constipation management things that we do sometimes have to do is a sacostomy, and then this is the peristeen. So sorry. So the sacostomy, if you're familiar with what a G-tube is, it's basically that same button that would go in the stomach, but it goes into the cecum of the large intestine. So on this lower right side, put the little G-tube there, and then each night you flush it with water and sometimes a little bit of Miralax, and then that will allow them to have a bowel movement daily. And you can usually kind of get into a good rhythm where you flush it with the water, and then within about 20 minutes or so, they have a bowel movement, and then you're done for the day. This new thing that we've been using is called a peristeen. Basically what you do is, I don't know if you can see my mouse, but this is a little catheter that goes in the rectum, and then you flush up almost to the top of the intestine, flush it with water, and then it causes the intestine to contract and push out the stool to have a bowel movement. And the goal with this is that you do it every 2 to 3 days, and that keeps you regular. So it's a nice alternative to have for the sacostomy, since sacostomy is surgery and this is non-surgical. So these are some of the resources from this presentation, but the two organizations or the two websites on top, the Rome Foundation, you're probably familiar with, but gikids.org is an excellent resource that goes into constipation and then a lot of other GI issues that you may come across. So like I said, I apologize for my allergies tonight. Really brief overview of constipation, but I'm more than happy and would love to take some of your questions about constipation or any other GI related issues you might have that you want to bring up tonight.
And feel free to unmute yourselves, show your camera if you'd like to ask questions.
No questions?
Actually,
Questions
hi,
about
Erica.
Hi.
Hi, this is Anne. My daughter Genevieve, she's 3 years old. She's been on a G-tube feeding for about 2 years. She's just been changing, I guess that's a toddler. We've just been having a lot of refluxes with her. And when she does have a reflux, it could be after meal, when she's full, when she's moving. And of course, she is a child with hypotonia on top of that. So we're wondering, what can we do to help improve her from not throwing up frequently, and also support her because she's still not having the oral feeding through her mouth at this time as well. And her bowel movement has been, I guess, for her daily is regular. And as you said, it's between soft and loose. So I don't know if that's concerning or not.
No, that sounds good. So it doesn't sound like constipation is affecting her reflux, which can be a problem, a pretty common problem as well. Is she on any medication for the reflux?
We are on omeprazole 5 ml daily.
Okay. Okay. And has that been helpful at all?
It's been helpful. It's hard to say it's not only that, because in addition, her secretion she has excessive saliva and phlegm, so it's quite thick when she does have a reflux. So we're trying to clear her quickly with a bolus or a suction.
Yeah. So, it depends. It's kind of hard to answer that without knowing the specifics. With G-tube feeds, you want to make sure, one, they're not getting overfed. So sometimes we have to slow down the feeds because that can definitely cause worsening reflux. Sometimes too, with the hypotonia, they're not digesting and moving the food from their stomach into their small intestine as efficiently as we would expect. And there are certain medications that can help with that. Positioning is a very common thing, which I'm sure you're probably already doing, but making sure she's upright during all of her feeds and continuing to be upright for at least 30 minutes after you finish is a really big one. There's also a medication called cyproheptadine, which was previously an antihistamine for allergies. But what we found over time is that, one, it can help with appetite. So our kiddos that aren't gaining weight as quickly, sometimes we'll use that. But it also helps with gastric accommodation, just meaning that it helps the bowels and the stomach be more efficient in absorbing the nutrients and the food a little more quickly, so that we can get rid of some of that nausea and those reflux symptoms. And I've had a lot of success with that. So that's something that you could bring up with her provider to see if that might be appropriate for her to try.
Okay, great. Those are helpful tips, because we are talking with a pulmonologist as well too, to help to do a little nebulizer treatment through her upper tract, because it's just so thick and we weren't sure to get medication for her excessive saliva or phlegm, or just go through this conservative plan first before we go to the medicine that really dries her up and constipate her on top of that.
Right. Absolutely. And then sometimes too, if you're having such severe reflux, it can cause you to have these upper airway symptoms too. So those two very often go hand in hand. And a lot of times we really have to get the reflux under control before the respiratory issues can get better as well.
Right. Okay. Well, that makes sense. Well, thank you, Erica, for that helpful information.
Absolutely.
Erica, and I see Mike has his hand up.
Yeah.
Thank you very much. I want to verify if much of this was geared more towards a partial or mosaic chromosome 18 children versus full chromosome 18 children. I said as the parent of a full, and I know that they predominantly are G or J fed, and so the prospect of a solid bowel movement really
goes down.
Transpiring.
I didn't really target it to the specific types. I tried to do just kind of general research on chromosome 18 abnormalities and pull out the common themes that I found. So I know that doesn't really answer your question, but I tried to make it as general as possible because I wasn't quite sure what the environment was going to be or the specific kinds.
Okay, and one more. Recognizing that you need specific information, but is there some sort of a chart or somewhere where, based on age or weight, we should be able to identify how much stool they should be producing per day or per week?
So once they get a little bit older, I know I showed that chart kind of right in the beginning. So I'll show this again. This just goes up to age 3. But even then, I mean, for the little babies, probably under a year, I probably track the frequency and the amount maybe a little more closely. After that, it's more so just trying to figure out what the patterns are, because every child is different. But the main things you want to look at is the consistency, the frequency, how are they acting when they're having a bowel movement? Are they acting hydrated? Are they having too many loose, frequent stools that now you're kind of worrying about, like, oh, their urinary output is going down, their mouth is looking dry, things like that. And you want to make sure it's all balanced out. So I wouldn't say there's a specific number that you should focus on, more so the whole picture of your child, how they're feeling, how they're functioning, and what do the other bodily movements and bodily fluids look like, to see kind of what their normal is and what that balance should be for them.
Thank you very much.
Sure, go ahead.
So I think at some point you mentioned. Oh, are you able to talk louder? Sorry, we can't hear.
I can barely hear you.
Can you hear me?
There we go. That's better.
That's better.
I was going to ask you about something you mentioned on the later slides. Kind of like giving, I don't know if it's a sort of enema, and then that is a sacostomy. So along those lines, my daughter has a J tube.
Okay.
And I was wondering if I flush her with water and then give her Miralax, will that be also a way to help her stool instead of giving her medication?
Not exactly. So you have to be a lot more careful with the water flushes through a J tube because you have to worry about the electrolyte imbalances going through the small intestine. Whereas when you go through the large intestine, all of those nutrients and electrolytes have already been absorbed in the small intestine. So you don't have to worry about that as much. You're simply just kind of pushing that stool through. We do have some kids, trying to think, maybe one or two that I can think of where we've pushed Miralax through the J tube, but more so through G tubes or the sacostomy. J tubes, you really have to be careful because you're typically on the continuous feeds, right? With a short amount of time that you're off of it, depending on what her regimen is. So I would be a lot more cautious pushing that through the J tube, just because you have to really balance out a lot of different things. So it's not quite the same idea, unfortunately.
Gotcha.
Yeah.
We have a question in the chat, and then I see Shivani has their hand up. What is your at-home clean out method?
Oh, great question. So it depends on the age of the child. Rule of thumb for age 9 and above is 15 capfuls of Miralax mixed in 64 ounces of fluid. So whether that's water, Gatorade, juice, however it is that you want to do. And then sometimes we add on an enema with it, and sometimes we add like a bisacodyl tablet or an X-Lax or something like that. But 15 capfuls for 9 and above. And then from about 6 to age 8, we do 8 capfuls mixed in 32 ounces of fluid. And then below that, we calculate it based on the weight of the child. And then also, usually for the older kids, I'll have them do that in one day. But for the younger kids, I'll typically spread it out over the course of about 2 to 3 days. So it's not quite as strong and as dramatic for the younger ones as we do with the big kids.
Thank you. And Shivani,
Absolutely.
did you want to ask a question?
Yes, hi Erica.
Hi.
I came in a little late, so I'm not sure if you've covered this earlier in the presentation. So I have a 8-year-old with I think with chromosome 18, he has a ring 18, but we've always had difficulties with weight gain. So he has celiac, which we found out a little later when he was 4 years old. That has helped him a little bit. But
I'm sorry, you cut it. What was that last part?
It seems like he has celiac.
Celiac, okay.
We found out recently he has celiac. But
Okay.
other than that, he seems like he's eating okay. But he ends up having a lot of bowel movement, and his body does not seem to absorb everything that he eats.
Okay.
So last 9 months, I think he's not even gained an ounce.
Oh gosh.
So we've had this, so he eats, he has a good appetite, but I don't know if it's related to muscle, like because he has hypotonia. So I'm not sure if it's related to muscle tone where, his body just, I don't know if it just slides through, because he does have a, pretty extreme hypotonia. So I just wanted to ask, we've gone to a lot of GIs here. We've had a lot of calorie counts, and we just, go back in circles every time. But have you seen, a case like this, or, we did try an appetite medication to increase his appetite, which worked fine.
Yeah.
But again,
He's just
it's
not absorbing.
how much he eats. but he's not
Mhm.
absorbing.
Right.
And he has at least 4 bowel movement a day.
And how long ago was he diagnosed with the celiac?
He was around 4.5, 5.
Oh,
He
okay.
just turned
And he's
8, yeah,
8.
8
Okay.
last week. So yeah.
Hmm.
Mhm.
Okay. And so he's been on a pretty strict gluten-free diet since then. And then
Yes.
still, has he had a colonoscopy?
No, he is not. He's had an endoscopy that
Sure.
gave for the
For the
diagnosis.
celiac.
Mhm.
Yeah.
Yes,
That
yes.
that might be something to consider if his GI provider thinks that's appropriate, because typically with celiac disease, once you've been on a strict gluten-free diet, and the evidence is still kind of up in the air as to how long you have to be on that before you start seeing improvement. But the kind of rule of thumb right now is about a year to allow that tissue in his small intestine, the villi, to really heal itself and start to function like it's supposed to, because that tissue has been blunted because of the celiac disease and the gluten. But once that's healed, it should start absorbing those nutrients again, and he should start to gain weight and grow appropriately. So my thought would be, if it's been, 3.5, almost 4 years that you've had this diagnosis and you've been following a gluten-free diet and he's still not gaining weight, then I would think there's something else going on that's preventing him from being able to absorb the nutrients like he would want him to. In our clinic, the next thing we would do is a colonoscopy to see if there's something going on that's causing his malnutrition. Stool studies. He had a whole workup with stool studies
Yes,
and
he
checked his?
has.
Okay.
Yes.
Yeah.
And he is a little constipated. I think a lot of
Mhm.
chromosome 18 kids are.
Sure.
But other than that, everything came normal in his stool study.
Okay.
Yeah, his calorie count was normal too.
Mhm.
But I'll follow up with a colonoscopy. I was just wondering if there's anything else that we are missing here, because he's just not gaining weight.
Yeah. And
So just
the
wanted
big
to make sure on.
Absolutely. And the big thing that we worry about, especially in pediatrics, when you're not growing appropriately, we've made all these dietary changes, is some kind of like inflammatory bowel disease that just hasn't been picked up yet. There's some kind of inflammation that can be causing the malnutrition. And a
Okay.
lot of times you can have normal labs, you can have normal stool studies. It's just the
Right.
poor growth and how it presents. And you're not going to
Okay.
pick up on that until you get the tissues from the colonoscopy. The upper endoscopy they've done sounds like that looks okay, except for the celiac. But really taking a good look at that colon I would push for that to kind of see if that shows anything else that you might need to be working on.
Okay, thank you. That helps. Thank you so
Absolutely.
much.
My pleasure.
Mhm.
Tracy, did you have a question?
Yeah, hi Erica, how are
Hi.
you?
I'm
Thanks for
good,
the
thank you.
presentation. Look, I
Absolutely.
just had a question, and it's not around constipation, sorry.
That's okay.
So my daughter's now 14, nearly 15, she tells me, but look, she's always had issues around gas, lots of wind, and bloating. And it comes and goes, but generally it's always there. Now the constipation, I think we got that under control many years ago, and sure, like children, she might have bouts of it every so often, but very rare. But it's more around the gas, just always windy, always lots of gas, and that therefore bloating and some discomfort of a night. Is that common? Is that and I guess her diet, we've got it. Yeah, I think we've got it fairly well. She eats well,
Okay. Yeah. So yes, that can be very common, especially if she has any motility issues, or again, the hypotonia can definitely relate to that, because essentially, if you think about it, if your internal muscles aren't functioning as efficiently as we would want them to, then the gas that we all produce, it normally just kind of flows multiple ways and comes out. And kiddos that have the hypotonia, it gets stuck in there, and it can move very slowly, and then it can cause that bloating feeling. And just kind of overall discomfort from it. So when I was talking about the fiber for the constipation for her, it would be the opposite. You want to make sure she's not getting too much fiber, because that can cause the bloating and the gas. Sometimes gas drops work. I feel like it's kind of a toss up. Some of my patients love them. Other patients, it does absolutely nothing for, but there's really no side effects to that. So that's something that you could definitely try.
So that is a possibility. Yep.
That is a possibility. And then the other quick thing that comes to mind is something called SIBO. I don't know if you've ever heard of that before. It's SIBO. Basically, it stands for small intestine bacterial overgrowth. This can be caused a variety of reasons. If she's been on long-term acid reflux medications, multiple antibiotics, sometimes diet, sometimes it just happens, but basically there's an overgrowth of bad bacteria in the small intestine. And the biggest symptom of that is bloating and excessive gas. And so we treat that by using an antibiotic for about 7 to 14 days, depending on the patient, and that can help that resolve as well.
Okay, but that is mostly if they've been on medication, because in her 14 years, she's hardly had any medication actually. So
okay, then probably
natural.
not. Yeah, probably
but
not
I'll have a look at that anyway. So okay. So gas drops I did try years ago, but to be honest, I haven't tried those recently. So maybe I'll try that again and see if it helps.
You can try it, just to see if it's not going to decrease the amount of gas, but it should help it flow more efficiently through her system, so it's not getting stuck and she's not having that bloating sensation that she gets.
Yeah. Okay. Fantastic. Thank you.
You're welcome.
Hey, Sherry, I see your hand up.
Hi.
Hi.
I just want to say I'm thankful that this group is here because mine's 19 and it's my first time joining your Zooms. And when she was diagnosed when she was 6, and we were just told Google it, and so we basically had nothing to go on. But anyway, I came in just to see, is it a common trait, because she also has autism and the chromosome disorder, so it's hard to decipher, or is it just, does she just have constipation? So it's
also anemic.
Yeah, she's anemic as well, but I wanted her to hear so that she can, she's 19, she needs to hear what's going on, and it's a common thing. But
absolutely,
one thing, basically, thank you for the group. I've been on Facebook with you guys for a long time, and so I get a lot of feedback and learning, but I rambled on. I just forgot what I wanted to say. She has a lot of bloating. She's had constipation forever. We've done the not melatonin, that's to go to sleep. What's the purple stuff?
The Miralax.
Done Miralax. I just don't know what to do because she's always in the bathroom.
And has she done those clean outs before?
No, she's rarely ever on she's never on any medication.
Okay.
Except for iron.
Well, except iron. She's rarely ever sick.
Gotcha. So you bring up an important point. So iron is very constipating. So if she's on an iron supplement and she's been constipated for a while, that's just kind of a double whammy on top of it. And I should have said this to begin with. I'm giving you medical advice, but really talk to your provider before you start anything. But I would definitely recommend doing like a full flush, a full clean out at home, and get those instructions from your provider, because what happens over time is your intestines just stretch and stretch and stretch to hold on to that hard stool. And even if you start a Miralax or she takes something every now and then for constipation, but nothing's really helping, you're not going to have a good impact until you get all of that old hard stuff out there and then out of there. And then you have to stay on that medication for maintenance for, at least 6 months usually, because you have to keep that stool that's coming through soft and mushy, and don't allow it to get hard and accumulate again in the colon, because we want that colon to, like I showed earlier, squeeze back down into its normal size and contract and function like it's supposed to. And that's just going to take time. So I think a home clean out would be really good for her. And then the daily Miralax, and then especially with that iron supplement, she's going to need something to help keep her going.
Yeah. She just said she uses a squatty potty, which we found a few years ago.
Perfect. Perfect.
She's been constipated, God, from when she was little. And she doesn't do Miralax much. She hasn't done Miralax, God, in maybe 2 years, just because we've done it for so long that she's like over it.
Understand. Totally understand.
I just feel bad for her, you know, 'cause she's
Mhm.
always in the bathroom. And even before we leave the house, oh, let me go again. I feel like I have to go again. It's like, how do you,
Oh,
that feeling? It's like anxiety too. Well, anxiety as well. But I just wanted to give some kind of feedback, but that's
yeah. It's very normal. And if I were seeing her in clinic, that's definitely what I would recommend is just flush all of that out and then figure out maybe it's not Miralax, maybe it's lactulose, maybe it's Senna, there's all kinds of things that we can try because I know it gets old taking that Miralax powder every day. But something to keep her regular to allow those intestines to function like they're supposed to. Autism is a very common, constipation with autism is very, very common. So to have that on top of everything else, it's just, like I said, kind of this perfect storm of things that you really have to be pretty aggressive with managing to get the relief from.
Okay. Well, I appreciate it. Thank you so much.
Absolutely. Good luck.
Thank
you. Mm-hmm.
Anyone else have a question? Is it Patricia?
Yeah. My daughter's a lot older. She's 42. So we've been dealing with this for a long time, or I should say she has. She's been on the Miralax. That didn't work very well. She's also, right now, she's using like a Senna or a Senacot. So she's learned how to manage it as she's gotten older, but it still becomes an issue. The biggest thing I found is you don't find any GI people that know anything, or no offense.
None taken.
Well, I've been doing this for a long time, and it's very hard to find physicians that are knowledgeable about children, that this is a chronic problem, and a lot of it's probably related to their growth chromosome 18 problem. What I have a question about, and I don't know if you've ever seen this in your clinic, because we just recently in the last probably 3 years have found out that she has a malrotation of her stomach and her organs, and there she's got a huge twist, I guess, in part of her stomach, and she has a large periesophageal hernia. So those are things that we're looking at now. Have you seen that? Because one of the surgeons recommended surgery, but I also hesitant to do that. But if we wait too long, then it becomes an issue of it might become emergent.
Right. And the tissue can become necrotic if you don't let it function. Yeah, I can't say that I have personally seen anything like that. But when you were describing it, kind of what they found, my gut reaction is, oh, she needs to go see the surgeon. So yeah, that definitely sounds like a surgical.
We've been to different doctors. We finally got connected with a university, a major hospital.
Wonderful.
And that's where the biggest thing we've gone through so much, that most of them, you just feel like they treat the problem immediate and then you go on your way. But I know, like I said, I've been kind of hesitant to pursue having the surgery. Who we talked to was excellent, as far as he took a long time to talk to us, but I didn't know if anything through the chromosome registry, if they have any records of other children or adults having a malrotation of organs.
And Patricia, have you posted it on our private Facebook group?
No,
I would. Okay.
Go ahead.
Oh, I was going to say, if you are on our private Facebook group, I would post it if you're comfortable. If not, I can post it and ask the question, because then we'll see some people who are responding and they'll be able to share their experience.
Okay. Yeah. All right. I hadn't heard this, and I'm assuming that some of the constipation and the issues she has is also related to that, but it's been a problem with bloating, gas.
The bloating and the gas for sure. And then if she's having any nausea or vomiting, that can also be attributed from the malrotation. But gosh, I'm sorry, you've had a long road trying to deal with that. And I'm a little biased, but I think pediatric providers are a little bit better at.
Seriously, until chromosome 18, there was no help out there at all. And, I mean, like I said, she's 42.
Yeah, I can imagine.
So it's been a long road without a lot of help or information, but
Absolutely.
So, all right, well, that's all I had. I was just curious.
Yeah, sorry, I don't have a lot of input on that one.
I did recently send some information that I got from the doctors because nobody's ever worked it up or done anything. They just happened to mention that this, by the way, did you know that her?
Oh, wow.
Yeah. And so I did send some information to Annis, and then she was going to refer it to Janine.
Oh, good. Thank you.
Yeah. All right. Thank you.
Thanks.
Any other questions?
I have a question. It was kind of stated or asked before, but just wanted to see if my issue is slightly different. My son is 13 years old and he is fairly regular. He goes to the bathroom, number 2, every day, which is great. He eats healthy. You know, he's not on a strict diet or anything because he loves to eat everything. He's not a picky eater. So, and you know, we haven't done any testing of any allergies or you know, any discomfort with any foods. I do though feed him a fairly healthy diet. He eats an apple a day, as well as he has 2 prunes every morning. So he is very regular, like every day. However, though, he is gassy. Like someone else mentioned. And I, you know, just wondering, you know, I was thinking about gas sacs or, you know, you mentioned fiber, don't do more fiber.
Yeah.
So that's a takeaway for me because I didn't know that. I was given him more fiber, you know, but you were saying something about FIBO.
SIBO, yes. SIBO.
Oh, okay. SIBO. And can you explain that just one more time? I'm sorry.
Yeah, no, that's no problem at all. So it stands for small intestine bacterial overgrowth. And there's a variety of things that can cause it, but I would say the most common things are antibiotics or acid reducing medications like PPIs or Pepcid, things like that. It can also be caused by infections. Sometimes people just get it, it's idiopathic, so we don't know where they got it. So there's a lot of things that can cause it, but basically it's an overgrowth of bad bacteria in the small intestine. And this causes an overproduction of gas and bloating. Really, those are the only symptoms for it. If you're having an upper endoscopy, they can do a biopsy of the small intestine and test for that, but it's not something that we do routinely. Typically, if we make those dietary changes, maybe we try some of the other medications and it's not getting better, then I'll do a trial of 7 to 10 days or 7 to 14 days of Flagyl, a metronidazole, and that will typically help significantly if it's SIBO. So I use that almost as a test sometimes to see if that's what's going on. But yeah, something to look into.
Okay, because yeah, like someone mentioned too, my son, knock on wood, he's fairly healthy.
Good.
You know, he doesn't get sick, so he's not on any of that stuff. So
gotcha.
But I'm
so
going to make sure I
unlikely,
listen.
but possible.
What'd you say?
Sorry, I said so unlikely if he's not on those medications, but still possible.
Yeah. Okay. Okay. Well, I'm going to make sure I listen to the recording and jot some notes down with that. So thank you very much.
Absolutely. My
Although
pleasure.
then when we say to him, stop, you know, because it's at school, the school is complaining. Like, you know, you never think you'd have these conversations, right? And so then when I say to him, hey, okay, we're going to school and, you know, make sure you go out in the hall or in the bathroom if you have to toot. And then like miraculously, you know, he doesn't have to toot anymore. So, you know.
Amazing, huh?
Right.
That's funny. Those teenage boys, you just never know.
That's right. That's right. Thank you.
Absolutely. Anything else?
Erica, can I just comment after hearing, I've forgotten the lady's name that just spoke. It sounds very similar for us with Jeff. And I guess one of the things that I've found helped with the constipation over the years, and we did have medications from time to time, but always we had stewed the prune and pear, and would put it on a cereal every morning. And quite often when she'd start to be a little constipated, I'd adjust that and increase it, you know, and even put in some yogurt through the day. And sometimes it worked, but sometimes we did have to end up using medications. And here in Australia, we used Movicol, which is a different one again. But yeah, I don't know. I always found that pear and prune. If I stopped it, you know, we had issues. But if I kept that up, it was amazing.
It is amazing. And something else too that just reminded me is probiotics. There's so much research right now on the benefit of probiotics just for general gut health, but also for constipation. And I don't know about in Australia, but here we have Culturelle for regularity, which I've had a lot of success with for my constipation kiddo. So that's just another tip that maybe that would help somebody if you tried that. You have to use it daily, and it takes several weeks for you to really notice the benefit, but it can be really helpful.
Actually, and we've had Jess on probiotics once again on her cereal since she was 1 year old or so. Since she's been eating solid, so we've had that constant as well. And I agree. I believe it's me. Well, we haven't taken her off it to see. See the effects.
Don't change it. If it's working,
she's been on it, and we just keep it going. Yeah.
Perfect.
Any other questions?
This is Kamala. I have a question. I've been watching, but I haven't even been able to listen because something came up right when this started. So what I'm wondering is, when I watched the replay, is if it's okay if I have questions, since I got pulled from this and I had every intention of being here. Can I email you if I have questions?
Absolutely. Yeah. I guess if Holly, is it easiest if they email you and then you can just reach out to me, or how do you want to do it? I'm fine.
No. If you're fine with it, what I can do is tomorrow, this video will be done downloading, and I can email it to everyone. And if you're okay, I can put your email address on that.
Sure, that's fine. Okay. Yeah, totally fine.
Thank you so much.
Yes, thank you. I appreciate that.
Yeah, not a problem. And feel free to reach out. I apologize again for my allergies being so bad at the beginning, but I really appreciate y'all inviting me to do this. It's been an honor. So thank you.
Hey, Erica, this is Shivani here again. What was the probiotic name you were just mentioning that helps with constipation again?
It's called Culturelle for regularity. And there's a kid version and an adult version. Truly doesn't matter which dose you use. Either one is fine.
Is that prescription or over the counter?
It's over the counter.
Okay.
Oh, okay. Thank you so much.
Absolutely.
I just looked it up. The kids version is like a yellow box with a green logo. Is that right?
Yes, exactly. Okay. Yep.
I'll include that in the email tomorrow too.
Okay, yeah, that'd be great.
Culturelle. Awesome. Any other questions? We really, really appreciate you joining us, Erica. There's so much information. And just you being available for questions. So thank you so much.
Absolutely. My pleasure. Y'all have a great evening.
Thank you.
Thank you.
Thank you.
Thank you. Thanks.
And don't forget to sign up for conference if you haven't and you're coming.
Bye.
Y'all have a good night.
Bye. Leave.